Okay, so I'll just get started. As I was introduced, my name's Amy Broadbent. I'm one of the senior physios in the hydrotherapy and rheumatology department down at QA. Today I'm talking about sort of keeping going, keep moving forward, and exercise and arthritis. So to begin with, just to kind of clarify, because obviously you've all got different kinds of arthritis, different conditions, and you're at different stages, you have different lifestyles, and you also have different needs and different goals. So today is quite a generalised discussion, and if there are any specific questions, you can always ask me at the end if you need to. So to begin with, we'll just talk about the common symptoms. Obviously, I'm sure a few of you might have a few more to add to this, but this is more the common side. So obviously, you've got your pain, joint stiffness, decreased muscle power, joint swelling, reduced exercise tolerance, reduced balance, reduced independent function, risk of cardiovascular disease, risk of osteoporosis, low mood, anxiety, risk of falling, increased fatigue. Now, I know it sounds like there's quite a lot of things there. I'm not saying you've got all of them, but there will be a variety of what your condition will present with. So why do we need to keep active? So I know a lot of us physios talk about exercise, but we do mean any forms of sort of physical activity that gets you moving and gets sort of your heart rate going. The reasons why we encourage exercise, here are a few things that exercise help with. So reducing heart disease. Inactivity can double your risk of a heart attack. This links in with the fact that exercise reduces your cholesterol. So not only does it reduce your bad cholesterol, but it will raise the high-density lipoprotein, which is a good cholesterol, which stops the build-up of fatty deposit in your arteries. By exercising, it will also reduce your osteoporosis, so that's the brittle bones, and by exercising, it keeps that intensity and the impact through your bones to keep them nice and solid. It also helps reduce obesity, so by burning the energy that you eat, you're reducing the amount of the weight you have, and also you're burning up all those calories that you eat. This also links into your blood pressure, so by improving the fitness of your heart will consequently help reduce the blood pressure. This consequently will also reduce the risk of stroke. So it has been proven that women over the age of 45 who walk briskly at least 3 miles per hour or more than 2 hours a week reduce their risk of stroke by 1/3. It also helps to maintain a good blood flow throughout the body to avoid clotting. So I'm sure some of you have been warned and heard about DVTs. That's a blood clot in your calf. Now, by keeping yourself mobile, it keeps that blood circulation going and prevents any blood clotting or coagulation in the calf. There's also evidence to suggest that it reduces the risk of diabetes, so it helps obviously maintaining that weight and keeps your blood sugars lower, preventing that diabetes. It also has been proved that it can reduce some causes of cancer, so it can half reduce the risk of bowel cancer, and breast cancer is less common in more active women. The good things, that it does increase energy and endurance. So by keeping yourself nice and fit, your muscles become more active and they get better at adapting to the exercises you do, so you tend to last longer. It also increases your psychological well-being. So it increases the release of your natural happy chemicals in the body called endorphins, which consequently can help reduce stress and therefore kind of improving sleep as well. If you're feeling more relaxed, you feel like you can sleep better. And by doing more exercise will sort of wear your muscles out and your muscles will naturally want to rest. So, what is physical activity? So there are everyday activities, either playing with your kids, your grandkids, going to work, up and down stairs, walking to the shop, or doing your gardening. So it's anything that you do in your normal daily life that keeps sort of maintaining your mobility and function. You've then got your health-enhancing physical activity. So these are things that you choose to do to try and help improve your health. So such as you might choose to go to the local pool to do some swimming, you might go walking, you might go cycling, dancing, or even kind of making the effort to do slightly different everyday activities. But these are the things that you've chosen to try and improve your health. The last on the list is sort of exercising and training. So if you're quite young and you've been diagnosed with an arthritis, you might work into doing weight training, running, gym classes, or even competitive sports. But it's all about for that performance gain. You might be kind of wanting to compete in a walking marathon or something like that, but you have to exercise and train to get those benefits. We generally tend to recommend a certain amount of exercise, and the Department of Health have advised for the ages of 19 to 64 that you should be active 150 minutes, which is 2.5 hours a week of moderate intensity. It would also alternatively suggest 75 minutes of vigorous exercise spread across the week. As you can see on my slide here, it does suggest that if you want to break it up, you can do. It doesn't have to be all at once, and sometimes people find it easier to do it in chunks. So now it's time to help yourself. How do you do this? Not only is exercise important, but in order to be active, you need to prepare your mind. So you want to focus on the health gains. By focusing on what you're going to achieve and benefit from, you're more likely to keep that motivation and exercise. You also need to be flexible with yourself. You have to remember that you're going to have good days, you're going to have bad days. So you need to make sure that if you can't do what you're planning to do, have something slightly less active, but still keeps you going. Have that plan B. Give yourself permission. So you remember that it's not a medication or exercise, it's both. Your GP will give you pain relief or alternative medication, but you need to exercise on top to get the real benefits from it. And soothe yourself. So remember, it can be uncomfortable to exercise, but you need to encourage yourself. You can do it, and it will ease the pain overall. So although you might suffer at the time, ultimately in the long term, it should give you that benefit. One of the ways we suggest to help you become more active is get yourself an exercise buddy. So there are a few things we suggest about Exercise Buddy. We tend to give you 5 recommendations. You want someone who's slightly fitter than you. So not too much in advance, but you want them to be slightly fitter so they can promote that exercise and try and encourage you. If you've got someone that's not quite as fit, they might hold you back and you might give up too early. You want someone that understands your condition. We all have good and bad days, so that person that you're exercising with you're going to the gym with, for example, they need to understand that there are going to be limitations and they're not going to push you past that. You want to have someone who can read how you're feeling. Obviously, with exercise, you do get that emotional side to things. If you're struggling one day, you need someone that can read how you're feeling and can push you where it needs to be. Someone who doesn't nag. So you don't want someone that's going to be on your back, getting you to keep working too hard. You want someone that's going to motivate you, but not make you feel down if you can't achieve what they want you to do. And you also can look into maybe having friends, family or peers, because they know you, they want to support you, and in the long run it gives you that better motivation. It has been proven that studies show that exercise partners keep you motivated for longer, so it's always beneficial to have someone with you, whether it be family members or friends, or whether it's the dog that go to the park with you. So goals. It's important to have goals to show that you're reaching and you're benefiting from what you're doing. If you exercise and you don't have a goal, it's really difficult to see where you've come from and where you're going to. we tend to suggest a few different ways of making your goals more appropriate for you. So we advise to make them quite specific. So make it appropriate to your lifestyle and something that you want to be able to achieve. You want it to be measurable. So you want to be able to say either, oh, I want to be able to walk to the shop. You've got that end point. You know that you've got that plan there. So it's not I just want to be able to walk further. It's I want to be able to get to X place in X amount of time. They need to be achievable. You have to understand that there will be certain things that we can never do. Okay? We need to make it so that these goals are reachable and you can get to them. It doesn't matter how long it takes, but as long as it is a possibility that you can do it. And you want it to be realistic and in a timely manner. So, as I said, you want to give yourself a time scale, whether or not you want to walk to the end of the road in a week's time, or whether or not you want to run a marathon. But you need to give yourself more time if you're going to run a marathon or walk a marathon than you are trying to get to the end of the road. You have to remember as well that obviously because of the arthritis, you might find that, as we said, you have good days and bad days. So if you're having a bad day, you need to be able to adapt your goals to make it more appropriate to that day. And it's always good to give yourself a little bit of a reward when you reach that goal to keep encouraging you to keep moving and to keep being active. One of the things we find in physio is that obviously patients come to us and they've been given these medications and they're not working. And you kind of encourage people to be active, but because they're in so much pain, it makes it very difficult. But you need to understand that exercise alongside the medications is important, and it's as much as a priority that you do your exercises on time as it is with having your medications. So make sure it's part of your treatment. Put it in your diary. Make sure it's non-negotiable. So if you have set maybe 3 days a week that you go for a walk or you mow the lawn or whatever exercise or activity you've chosen, make it so that you keep encouraging yourself to do it and have it set. Treat it like a hospital appointment. So it's there, it needs to be done, and it's important. Okay, and even if it's 10 minutes a day, make sure you do a little bit every now and again just to keep yourself going. And don't leave it too late. If you feel or see the symptoms, you've already lost ground. So if you start to feel that you can't walk as well as you used to, you're struggling to get up and down the stairs, it generally means that it's a little bit too far gone. You may have reduced some of your muscle strength, you've lost that endurance or that aerobic capacity, so you need to act on it. So you want to be active from the beginning to maintain that function and ability as soon as possible. So, ways of how to keep yourself active. There are lots and lots of things to do in the community. One of the things we promote at the hospital is walking for health. So you may have seen some of the information in the exhibit hall. If not, you can go online and you can find further information. The ones we suggest, and obviously because we're in the local area, you've got the Portsmouth Healthy Walks, Fareham Walking for Health, and Havant Walking to Health. Okay, so these provide weekly walks, varying in difficulty. So some might be more flat, some might be more hilly, and they also vary in distance. So you get the shorter walks and you get the longer walks depending on your ability. They come in multiple locations. So the Portsmouth Healthy Walks will be a variety in Portsmouth, and also Fareham and Havant. And wherever you go in the country, there are these walks. So even if you move out of area, you can find similar groups running in different areas. An important thing at the bottom as well, it is free of charge. So as long as you get in contact with the people organising it, you can turn up and it's completely free. So another thing we work alongside is the GP Exercise Referral scheme. Now, although it says GP, physios can refer alongside it. And basically what it is, it's a group of professionally trained health trainers They're there to give you sort of help in the gym and the pool as well. So they are more of a gym-based team. You've got some in Mountbatten, which is the Steps to Health. Havant Horizon, Exercise Referral. In Fareham, you've got Exercise Referral as well. Gosport is GP Referral Scheme. And you've got the John Pound Centre, which has the Positive Plus. Now, as I said, you can get referred from your physiotherapist or from your local GP. I know that the Steps to Health are also based in the exhibit hall as well, so if you need any information, you can go through them as well. But they are a really good scheme. They work with people with lots of different health conditions, so it doesn't have to be arthritis, but it's a way of getting that activity up with someone there to help support you. You've also got the Health and Wellbeing team. Now, if you need to give up smoking, or if you want to lose weight, or even give up alcohol, these are a really good team to work with. They give you that care and support, they're trained health professionals, and they provide that holistic approach to your treatment. Again, they are in the exhibit hall if you need further information, but they're a really good team to help you kind of improve in those areas. So in terms of the local gyms, there are a lot around the area. You've got Mountbatten Centre as we're here today, Horizon Leisure Centre, you've got the Pyramids, Nuffield Health across the way, Pure Gym, 24/7, Marriott Hotel, Rocco, Gosport, where have I gone? John Pounds, Spirit Health Club and David Lloyd. Fareham too. So there are hundreds of gyms that you can go to. Again, some people aren't, if you're not interested in a gym environment, then there are lots of other places you can go as well. But they also have the local pools there. So if you've been down to the hydrotherapy department, you've got an exercise program, there's somewhere you can go. You've also got your classes. Now, we do encourage a class environment. Sometimes gyms are a bit too daunting, they're not that fun, and they're a bit regimental. With a class, it's a bit more exciting, you get to meet people, and there are a variety of things you can do. You've got yoga, chair aerobics, boxercise, Zumba, normal aerobics, aquafit, spinning, gym balls and circuit classes. So there are a huge variety of things that you can do with all different abilities. The only one thing I would say is that when you do give something a go, if you don't like it the first time round, there's always other options you can try of the same thing. If you like Pilates, you might not like it with one instructor, but a different instructor might have a different twist on things and you might prefer it. Just remember to speak to the instructor if you do have any issues. They can always advise you to change an exercise or to advise you of something better that you might be able to do instead. The alternative is you help yourself at home. So going for a walk with the family, taking the dog out, is always a great way of getting that exercise in. If you like baking, make sure...
Thank you.
Oh, that's not me. So baking a cake is a great way of getting some exercise. Just make sure you try and do it hand rather than using a mixer, because that's cheating. You've got hanging out the washing. So for those of us that don't have tumble dryers, and when the sun was out, you can hang your washing out on the line, get a bit of exercise stretching those arms up. You've got mowing the lawn, okay? So pushing the mower around is great exercise. It's quite a heavy bit of equipment. If you've got a bit of a slope up your garden, again, it's really good cardiovascular exercise, and it can take, well, depending how big the garden is, but it's a good way of getting exercise. The last thing is obviously, if any of you are into your sort of technology, you've got the Wii Fit. So the Wii Fit, you do lots of different exercise on there. Balance, I think there are some Pilates classes. You've got tennis that you can do in your home, etc. And there are lots of other sort of gaming devices that you can use. So if you are interested in those sort of things, get your kids or your grandchildren to kind of help you out if you're not too technologically advanced yourself. So obviously I'm from Solent, but we do work closely with Portsmouth hospitals alongside the consultants and also other GPs in the area. We're working closely with all the different councils to try and make it the easiest way to get yourselves nice and active. Hence we're running all the sort of the community classes, but also those referrals through the hospitals and through the GPs. Just one last thing I'll leave you with is our exercise pill that we recommend everyone takes. It's to treat your high blood pressure, diabetes, hyperlipidemia, osteoporosis. But all we say is take this new pill out every day, take it out for a jog, take it to the gym, take it for a bike ride, and just keep yourself nice and active. Does anyone have any questions at all?